In 2014, a 12-year-old girl in Kentucky became pregnant after being sexually assaulted by her stepfather. Like other children in the past, this sparked national debate. But what was missing was her voice. What would it mean for her to be forced to carry that pregnancy to term? Stories like hers are not isolated incidents. They represent real people facing real consequences with no say in their futures. Whether you agree or disagree with abortion access, chances are someone you care about or have faced or will face a decision regarding an unintended pregnancy. Understanding the complexity of this issue is not just about political opinion, it's about compassion, autonomy, and dignity. After reviewing legal, medical, and psychological perspectives, I support the belief that women should have the right to choose whether to carry a pregnancy to term, regardless of the circumstances that led to conception. Today, I ask you to consider the consequences of limiting reproductive freedom. We'll examine the impact of forced pregnancies, the circumstances that led to unintended pregnancies, and a plan that supports reproductive autonomy and safeguards bodily integrity. Forced pregnancies harm individuals and society. According to the World Health Organization, criminalizing abortion doesn't decrease abortion rates, it increases unsafe procedures which threaten lives. World estimates from 2010 to 2014 show that around 45% of abortions were unsafe. Of those, around 8 to 11% account for global maternal deaths due to hemorrhaging, infection, and organ damage because of unsafe procedures. In regions with restrictive laws, the death rate from unsafe abortions can exceed 200 per 100,000 procedures compared to previous years. The American Psychological Association reports that unwanted pregnancies significantly increase the risk of long-term mental health challenges, including depression and PTSD. Women who carried unwanted pregnancies to term experienced poorer mental health outcomes later in life, including high rate of depression and anxiety. They often struggle with bonding and emotional connection to their child, which can lead to lower psychological well being and increased stress. When reproductive decisions are taken out of someone's hands, the result is more than physical danger. It's the erosion of autonomy and trust in medical systems. Root factors behind the issue. One of the causes is sexual violence and coercion. A CDC study showed that nearly 3 million women experience rape related pregnancy in their lifetime. That's 1 in 20 women. Sexual coercion is defined as non physical pressure to engage in unwanted sexual activity and was found to result in pregnancy more frequently than rape. Some women are raped by their intimate partners or former spouses and are scared to report it due to fear of injury. A second cause is due to the lack of access to contraceptive and education. The Guttmacher Institute points out that barriers to reproductive education and affordable contraception significantly increase unintended pregnancies. Without access, individuals face numerous challenges when it comes to family planning. Financial limitations, limited healthcare options, and social stigmas can all be barriers. Many young adults express a desire to avoid incidental pregnancies but lack the educational resources or have misinformation about it. Finally, there's the medical complexity of it all. Not every pregnancy is viable. Conditions like ectopic pregnancies or fetal abnormalities can endanger the parent's health or result in non survivable births. Blanket abortion bans ignore medical realities. In February of this year, Adriana Smith was declared brain dead at 9 weeks pregnant. Due to Georgia's strict abortion laws, she was kept on life support until her fetus reached a viable status. The baby was delivered in June. Medical situations like Smith's are far too complex to have blanket laws in place with no exceptions. So now that we've uncovered the depth of this issue, the question isn't just if change is needed, but how do we bring it about? Now we do what we can to protect the right to choose. First, we bring about policy proposals. We need to uphold a national standard that guarantees abortion access and block laws restricting healthcare decisions between a patient and provider. A policy proposal from the Center for Reproductive Rights recommends requiring de identification of reproductive health data, restricting law enforcement access to electronic health records. Secondly, we expand access to resources. States can provide comprehensive reproductive health education, accessible contraception, and counseling services to reduce unintended pregnancies. They could also invest in community based reproductive health centers and telehealth services so that patients could be educated and be discreet from their own home. Lastly, we need to protect medical autonomy. There needs to be a creation of legal safeguards for doctors to make care based decisions without fear of prosecution. Strengthening these constitutional interpretations would shield healthcare providers from political pressure and allow them to act in the best interest of the patient. The issue isn't abstract. These are real people, real choices, and real consequences. Denying someone the ability to make this decision themselves reshapes every aspect of their future. You don't have to agree with abortion to support the right to choose. But ask yourself, should any government or court decide what a woman must do with her body in the most vulnerable point of her life? Pregnancy changes lives, but the power to choose should belong to the person whose life will be most affected. Compassion demands choice, not coercion. Justice demands autonomy, not control. And dignity demands a voice, and we must listen.